There's a very significant problem with military medicine.
The DoD is fighting you from letting you know the truth. Why are they hiding it?
It's shrouded in darkness.
We've got to make sure that they're held accountable.
After 2 years investigating military malpractice, battling the Defense Health Agency for records, and interviewing nearly 20 experts, patients, advocates, attorneys, and lawmakers, it was a package that arrived in the mail that is helping to crack a curtain of darkness, the one around negligent care at the hands of military doctors.
Nobody would know about it if it wasn't for whistleblowers within the Defense Department or investigative journalists.
A whistleblower sending our national investigative team documents typically kept confidential by federal law. We're seeing something families don't when their loved ones are killed or severely injured by military providers. It's paperwork that details the play-by-play that happens after a mishap in a military medical facility, as doctors lay bare problematic and tragic cases. After a death or serious injury, this is the first step the military typically uses internally to evaluate the potential for discipline or liability. It details whether doctors made errors in technique or judgment, delayed diagnosis, communicated ineffectively, even whether equipment was missing or failed to work. It asks two critical questions. Was the incident preventable? Did military providers meet the standard of care? But even when mistakes are made and acknowledged in black and white, what's said in this paperwork is withheld from military families, even if they sue or file a claim.
It's a chasm. It's a chasm of untruths, zero transparency.
Susie Way feels a void unlike any other. The kind only a mother who's buried a son can possibly understand. The hollow of heartbreak amplified by the aggravation of trying to figure out what killed him in the first place.
At what point did you know something is really wrong with Jordan here?
From day one. And I live with that guilt. I live with that guilt. That why didn't I get on a plane and do something about this? But he kept saying to me, Mom, I'm going to be okay. I trust them.
Jordan Way had no reason not to trust the medical staff at Bush Naval Hospital at 29 Palms in California. He was one of them. The 23-year-old Navy corpsman filled prescriptions as a pharmacy tech, but it was the one written for him after routine shoulder surgery that would turn out to be a poison pill.
He wound up in the emergency room several hours after he was released from the hospital. They didn't keep him. I didn't understand why they didn't keep him there.
Jordan, who by all accounts was otherwise fit and healthy, had surgery in December 2017. Records show he was discharged with oxycodone for pain. But just hours later, he was brought into the ER, disheveled, sobbing, and in very obvious distress, telling staff the medication was not working. His doctor increased his dose, added a muscle relaxer, and sent him home. Jordan's fellow Navy corpsman keeping watch, dutifully doling out pills as prescribed by the doctor. The next day, still feeling no relief, he called his surgeon again, who increased to the maximum dose without further evaluation. Despite continued severe pain and more calls to the hospital, Jordan still wasn't seen in person. He died just 3 days later from opioid intoxication. Records showing he took more than 80 oxycodone as directed.
He was opioid naive, and the dosing that the doctors were giving him, the other dosage, they weren't clearing his system. So he was having a buildup of toxins in a very short period of time.
But it would take years of fighting for his family to learn more about his death, requiring multiple Freedom of Information Act requests and congressional help to get Jordan's file.
Your mind just starts writing a story that you don't have any content, true content to fill in the gap, so to speak. And then to try to get that information and to be told continually, we don't have to tell you anything.
The Ways never got that confidential form we showed you earlier. What they did get left a lot of questions. Jordan's file filled with black holes. The names of medical providers, even commanding officers, covered up. The curtain of transparency about who was involved in his care firmly closed. It's not the first time we've seen military officials playing doctors of defense.
What we reported, did it surprise you, shock you?
Of course it shocked me.
U.S. Senator Chuck Grassley reacting to the findings of our previous investigation into military malpractice. After filing numerous information requests over the last 2 years, we obtained data showing between 2018 and 2022, there were nearly 500 military medical provider reports to a confidential government data bank that tracks discipline, lawsuit settlements, and malpractice payouts. Hundreds of suspensions and disciplinary actions have been taken against military providers following misconduct and mistakes that have resulted in injuries and deaths. And nearly $1 billion in taxpayer money has been spent on malpractice claims filed against military providers in the last 15 years. The names of all of them are kept confidential.
In the civilian side, we know who those people are. Their names are public. And the public ought to be protected from people that don't deliver medical care the way that the profession dictates.
What do you think about that double standard that the Defense Department, the DHA, keeps all this information secret and confidential?
Transparency brings accountability. You've heard me say that hundreds and hundreds of times.
Grassley, a longtime advocate for transparency and auditing, especially when it comes to the military, wouldn't commit to an investigation into what our reporting uncovered. But one agency is already looking into how the Defense Health Agency handles the discipline of doctors and providers who treat service members, the Government Accountability Office.
It's important for us to ensure that they are getting care that is from providers that are competent and qualified.
Sharon Silas is a director in the GAO's healthcare team. She oversaw a recent audit of the Defense Health Agency that looked at 55 discipline cases at just 4 military treatment facilities. It found military doctors in some cases were not being suspended as required while investigations were done. Notifications about suspensions to state medical boards and that confidential data bank were sometimes delayed for weeks or months beyond the required deadline. And some of the military facilities weren't notifying other hospitals or clinics about discipline at all, both in and outside the government system.
It's important for those healthcare systems to understand and know what types of concerns have been raised.
Their concerns often kept secret from military families.
And I do have to laugh. This thing is as broken as the system is.
Susie Way was given a box of ordinary things that sat on her son's nightstand the day he died. Ultimately, she never got what her family really wanted, justice for Jordan. The Ways submitted a malpractice claim with the military, along with expert testimony from physicians who reviewed his file. They concluded the doctors who treated Jordan were negligent in overprescribing and failing to evaluate him as he took more and more of the pills they ordered while his pain continued. The experts called his death avoidable, yet the family's claim and subsequent appeal were denied, along with nearly half of the claims submitted since the start of 2020.
If they can deny claims, if they can fail to pay people, if they can keep everything a secret, is there any incentive to do things better?
No. What? They hold all the cards. They hold all the cards. And they're not being, and the DOD is not being held responsible.